FAI syndrome and labral pathology of the hip. The labrum of the hip, known as the acetabular labrum, is a biological washer that improves the congruence and stability of the joint. There are a number of reasons why the labrum may develop a tear, but one of the most common reasons is the shape of the hip, lending itself toward abrasion of the labrum. Some patients will be born with a shallower hip socket, a condition known as developmental hip dysplasia. And these patients will be put at increased risk of loading the edge of their socket. Others will develop bony bumps around their growth plates during adolescence, and this can lead to pinching or impingement of the soft tissues at the front of the socket, which includes the labrum, between these bony bumps as the knee moves up toward the chest. This is called FAI syndrome or hip impingement syndrome when there is clinically corroborating pain. One of the challenges faced by clinicians is that tears of the labrum are not always painful. One prospective study showed that 40% of patients who had a symptomatic labral tear had a completely asymptomatic tear on their other side. As many as 55% of athletes have the criteria for FAI on scans, but only a small proportion have pain or the FAI syndrome. Diagnosis. Patients with symptomatic FAI syndrome often give a history of increased pain with squatting or lunging activity, and they've usually been athletic across a number of sports involving knee to chest activities like kicking and bending down. The pain is generally described as a deep groin pain. On examination, there is pain, a reduced ability to squat and get into low ranges of flexion, and the knee going to the chest or the failure position can be particularly painful as well. X-rays tend to show preserved joint space, but a prominence around this head-neck junction here, and a loss of the normal sphericity of the femoral head can be seen. Some patients will also have a prominence of the edge of the socket, which is called a pincer lesion. The labrum of the hip can only be appreciated well on imaging using an MRI. The MRI arthrogram is an MRI scan that's performed after injection of contrast, and this is very accurate at picking up subtle labral tears. However, as I mentioned, even a tear of the labrum can be asymptomatic, and so it can really help the diagnosis to undertake a local anaesthetic injection into the joint and then retest the joint in order to determine whether the pain from the labrum then goes away. In my practice, I prefer to have patients undertake an MRI arthrogram with both local anaesthetic and corticosteroid all at the same time, so we can then determine if a labral tear is present, whether the tear is causing pain, and if there is then sustained pain relief, the patient can move on to progressive rehabilitation. Management. Most patients with FAI syndrome and labral tears can be treated non-operatively. However, it is a slow process. The Warwick Consensus Statement is an evidence-based guide on the management of this controversial area. The first step is to understand the biomechanics of deep squatting and lunging and how they contribute to pain and impingement, so that any aggravating activities can then be modified. Patients need to understand that their hip shape or their morphology has been there long term, and that there are many people with the same bone shape without any pain, and therefore changing this with surgery is not a necessary first line treatment, nor is there strong evidence that it's effective in the long term. When there's significant pain and the joint is very inflamed, a course of anti-inflammatory medications or a cortisone injection for more severe symptoms can help settle that pain back to more manageable levels. This can then open the door to higher quality therapeutic exercise for the stabilizing muscles of the hip, called the deep external rotators. A skilled rehabilitator will then also be able to address the underlying impairments of the person's movement at the lumbar spine and other joints. This is what we call the kinetic chain. Some patients benefit from simple proprioceptive measures like taping, orthotics, or a hip brace. A surgical opinion to consider hip arthroscopy is only warranted if there's significant hip deformity and severe symptoms not responding to treatment, or with a proven symptomatic labral tear after MRI and injection that hasn't responded to a solid 4 to 6 months of appropriate rehabilitation. Unfortunately, patients with severe FAI and labral tears are known to be at higher risk of developing hip osteoarthritis in future. However, there is no longitudinal evidence to suggest that surgery prevents hip osteoarthritis.
I hope you found this video useful. I create these educational videos to help empower patients by allowing them to understand their problem, treatment options, and the expected recovery. Please remember, this lecture is for educational purposes only, does not constitute the giving of medical advice, and no patient-doctor relationship is formed.